Module 7, Objective 12, summarize the effects of aging on the nervous system. At around the age of 30, you have anatomical and physiological changes that begin to take place within the central nervous system, and these changes accumulate over time. 85% of people over the age of 65 have changes in the performance as well as the function of their central nervous system. Those changes include a reduction in the overall brain size and weight. You get a decrease in the volume of the cerebral cortex. The gyri become narrower and the sulci become wider. And you have larger spaces between the meningeal layers, specifically the subarachnoid space, between the arachnoid mater and the pia mater. In addition to that, you get a reduction in the overall numbers of neurons present within the central nervous system. And this shrinkage is linked to a loss of mainly cortical neurons, so neurons within the cortex. You do not have neuronal loss within the brainstem. And if you think about the functions of these various components, the brainstem is very basal. It handles a lot of our autonomic functions such as heart rate and respiratory rhythmicity. So we can't really afford to lose a lot of neurons in that region. Meanwhile, the cortex does experience quite a bit of loss. In addition to overall neuronal loss, we also have a decrease of blood flow within the brain. And this can be caused by a number of things, one of which is arteriosclerosis. This is when you get fatty deposits within the walls of the vasculature that feed the brain. And this is going to reduce the overall blood flow through the arteries, increasing our chances of rupture. A cerebrovascular accident, or CVA, or stroke, is when you actually have damage to the neural tissue due to a loss of perfusion or a loss of blood flow. And we find that in cases of CVAs, you actually get damage in the surrounding neural tissues. In terms of synaptic activity or synaptic organization of the brain, the number of dendritic branches and spines and interconnections overall decrease, and you get a loss of synapses. And the rate of neurotransmitter production also declines. So the postsynaptic potentials are more difficult to initiate. Plaques and tangles, these contain deposits of various peptides, primarily two forms of amyloid beta proteins, appear in brain regions specifically associated with memory processing. Anatomical changes linked to functional changes. Neuronal processing becomes less efficient with age. It becomes more difficult to consolidate memories, so it becomes more difficult to memorize. And then the secondary memories are even harder to access. In terms of sensory systems, all of our main senses, such as hearing and balance and smell, become less acute, and reaction times are slowed. Reflexes are weakened or even disappear. With respect to motor control, our precision decreases and it takes longer to perform regular tasks. Incapacitation, 85% of the elderly population develop changes that do not interfere with abilities, though some individuals become incapacitated by these progressive changes within the central nervous system. Senility, also called senile dementia, is degenerative changes that include memory loss and anterograde amnesia, which is the loss of the ability to store new memories, emotional disturbances, or even Alzheimer's being the most common type of senility.